There are 7 different serotypes of foot and mouth disease virus: A, O, C, Asia 1, SAT1, SAT2 and SAT3. Foot and mouth disease virus can infect all even-toed ungulates such as cattle, sheep, pigs and goats, and is the most infectious animal disease known. However, not all species are equally susceptible. Even within some foot and mouth disease serotypes, strains of the virus have emerged that have a restricted host range, such as the pig-adapted Cathay topotype found largely in Asia. The characteristic lesions in foot and mouth disease are vesicles, which are fluid-filled blisters. These are formed in all vesicular diseases and can lead to similarities in the clinical signs presented. A striking feature of foot and mouth disease is the speed of development of clinical signs. In pigs exposed naturally to a high-level challenge with type O virus, the first clinical signs can be evident within 24 hours of exposure. Vesicles normally develop within 2 days of exposure to virus. Spread of infection to animals in contact can also be extremely rapid, with pigs recognized as important amplifying hosts for the virus. Young or weak animals infected with foot and mouth disease virus may die suddenly. In pigs, this mortality can sometimes extend to animals up to 6 months of age. On post-mortem examination, these animals usually have some areas of necrosis in the heart due to myocarditis and evidence of heart failure. Rarely, sudden death of young animals may be the first indication of an outbreak of foot and mouth disease. In Australia, lameness and vesicular lesions are much more likely to be the first indication of an outbreak. Severely affected adult animals usually survive after developing debilitating lesions that cause considerable suffering as a result of lameness, fever, and sometimes loss of appetite due to oral ulceration and inflammation. Pregnant animals may abort, and milk yield from lactating animals will usually fall. Under field conditions, foot and mouth disease can be difficult to detect, especially if the animals cannot be restrained properly, preventing examination of the oral cavity, or if the lower legs are heavily soiled. Multiple animals may need to be examined thoroughly before typical lesions are seen. Disease recognition is also complicated if only older healing lesions are present when the disease is first suspected. Lesions in sheep, goats and deer can be hard to detect. This was a major challenge in the foot and mouth disease outbreak in the UK in 2001, since many infected sheep developed inapparent or very mild signs of disease. In sheep, the hair on the legs can obscure lesions on the coronary band. If you suspect any vesicular disease, you must report it immediately to the Emergency Animal Disease Hotline or your nearest animal health office immediately. If reporting a suspected case of a vesicular disease, you should obtain instructions about action to take. You and others on the farm should not leave the premises on which the suspected disease has occurred until permission is granted, and only then after appropriate decontamination. Under no circumstances visit another farm or have contact with other animals. You should also prevent animals from leaving the premises and animals from outside the farm entering the premises. The first signs of foot and mouth disease in pigs can occur within 24 hours of exposure to virus. Affected animals appear uncomfortable and reluctant to move. The pigs develop a fever, and as a result, the skin of white pigs may be reddened. Blanching of the skin at the coronary band can sometimes be detected by this time, but can be easily missed. However, it is soon followed by the development of vesicles, especially on the coronary band. These usually rupture within about 24 hours. As the disease develops, the animals prefer to lie down and won't move. Pigs squeal if you pat them or feed them, and if you try to move them. Reluctance to move may be harder to detect in pigs reared on soft bedding. Lesions are found around the top of the hooves, on the heels, and between the digits, and may extend up the legs. Vesicles sometimes occur in the oral cavity and on the snout, but these are found less frequently than foot lesions and rupture quickly. In lactating animals, lesions may appear on the teats. Within 3 days of signs of illness first developing, the vesicles on the feet have ruptured, leaving raw ulcerated lesions with tags of epithelium attached. As the disease progresses, lesions at the coronary band can lead to early separation and even sloughing of the claws, especially if the animal is forced to move. The exposed surface of ruptured oral and snout lesions is covered by fibrin and other debris as the healing process commences. Old lesions of foot and mouth disease may be recognized by linear depressions in the claws parallel to the coronary band that form as the pig recovers.